Hi and welcome to the GE Voluson eye training from Providian Medical. Before we get started, let's take a quick look on how to connect the transducer. First, make sure your image is frozen or the power is off. But it's going to come like this. And you're going to make sure the cable is facing forward. You'll push it in, and sometimes it's hard to get in there, but make sure it's snug and even all the way across. And you'll pull up this locking mechanism here, and the probe will be locked in place. You'll boot the system by pressing this power button right here. And now we'll take a quick look around the user interface, what all these buttons mean, and what it does from here. Now, as with most ultrasounds today, the design is really around your hand for while you're scanning. The most commonly used functions for the scanning process are going to be here around your hand. You have your trackball here, moves the cursor around the screen and does various things for measurements. You have your set keys here, and then some other buttons here. Your cheat sheet to what these buttons do that aren't labeled. You have three here, a left, right, and a center. Right here, this where it says menu, right here it shows a little circle. That means this is the trackball and telling you what the trackball will move, and then you have your set and set keys. When this has an option to go, it'll tell you up here what exactly that function does. Other things, you have your imaging modes, M mode, pulse wave Doppler, color flow, 2D and 4D imaging modes, calculations, basic measurements and calculations here, auto optimization, clear to clear comments, annotations, and arrows that are on the screen, exit button to exit from various menus, report, archive for seeing your previous patients, new patient key. All of these we will go on through the training, but this is a nice way to take a quick look around the system, by the way. You have your depth keys, dual screen, quad screen, and single screen, and these will be when you're making OB measurements and also effective in 4D mode. These are your pre-programmable keys, P1, P2, and P3, which you'll set to save images, print images, or save loops. You have your standard keyboard here, but also you have your end patient, you have your help for diagnostic help, your end patient. Application, this is what you'll select when you get an exam started. Utilities for your system setup and measurement setup. USB to eject USB devices that are attached. Power, you won't touch these. Arrow for annotations, body marks, text, and your delete key for also deleting arrows and annotations. Moving around the screen, on boot up, it starts up with this application. So where you can select your application, and most of the time if you're doing 4D, you're going to select the second and third trimester. You're just going to use the trackball, click set to get there. You can also change it up here. You'll see these numbers all the way down the line here, 1, 2, 3, 4, 5, 6, 7, 8, X, R, I, D, F, Z. Those are shortcut keys, so you don't actually have to click to get this arrow on the trackball and then go reselect a different setting or measurement or of that some sort. You can simply click, if we want to get reset to second and third trimester, we'll just push the 4 and it will reset that. We can also turn on and off our crossbeam, speckle reduction low, speckle reduction high, and features like that we will get into later. Up here you'll have your patient name and any exam information, your indices, your facility name, the date, the time. Along here, this is information about your scanning mode and what you're doing. You have your harmonics, tissue harmonics low, your power's at 97%, your gain level, your color maps, persistence, enhancement, and various imaging functions if you choose to go ahead and optimize your image with various functions. You can change some of those here. You have your angle here this will change the angle of, let's show you that, the angle of the sector in 2D mode. Focus depth. Your focus depth right here is a little triangle showing you the focal zones and where you want the image to be focused most clearly to make it the clearest. You can add focal zones, clicking left and right, 1, 2, and 3. And you do this to increase the area in which you want the ultrasound to create the best image. Note that when you do add focal zones, it will slow down your frame rate. Here, we talked about this key up here. It says change. So this is saying what's going to happen with the trackball right now. So it's saying 3 dots, meaning the trackball won't do anything. If I click this to change, now green is highlighted for position, and this is just going to change the position of the probe on the screen if I want to move that around. Then I can hit it again to make sure that I don't make any more changes. Zoom to zoom the image greater, and you have your frequency. You can increase this, since it's on harmonics, you can go high and low. Moving on from that, I did adjust these angle. These are soft keys that are going to refer to any of the information up here. See, it says zoom, plus and minus. So we have zoom, plus and minus. Focus depth, it says up and down, so we can change focus depth up and down. Focal number, plus and minus. Angle, 70. Those will change with each imaging mode that you're in, and they will have various functions. In the middle, we have our harmonics imaging, that's HI. Doppler invert, to invert the spectral Doppler. This reverse R flips the screen this way, and 3D R will flip the screen up and down. And when you're in 3D, this will also flip the baby 180 degrees. For those of you familiar with 4D, that's what you do to flip the baby over. Otherwise, we will get to that. For those who don't know, we'll get to that in a later movie. Coming down here, we have our TGCs. Typically, you're going to have them in the middle going further up. That is a personal preference thing, but really shouldn't have them all the way to the one side or all the way to the left or right. These are gain controls, so they will increase gain at various spots in the image. So like this, they each refer to a different spot in the image. Typically, you'll want them in the low and increase higher. This is your gain, overall gain control, where you can turn the gain up and down in the entire image. And then active mode, you'll push this to do various things in like change gain into 2D color Doppler or something like that. You'll change that. Next, we'll get into imaging with the Voluson Eye.